Hello viewers, my name is Ngwenya from Ocean Pet Foundation. Ocean Pet Foundation is located between 14 and 15 along Jason Moyo in Bulawayo. Today I'm going to tackle through shock and how can it be managed. Right. I'll start by defining the term shock. I'll give you 3 definitions of shock. Shock is a condition of acute peripheral circulatory failure causing inadequate and progressively failing perfusion of tissues. That's definition number 1. Number 2, shock is a condition of general body weakness due to inadequate supply of oxygen to the brain, owing to pump failure, blood vessel burst, or blood loss. Those are the 3 definitions of shock. I know some of you are still mesmerized by the term perfusion. Now we'll define the word perfusion. Perfusion is the circulation of blood within an organ or tissue. That's the definition of perfusion. I'll also give you another definition of perfusion. It is the process whereby blood enters an organ or tissue through arteries and leaves through the veins, providing the tissue with nourishment and removing waste. Those are the 2 definitions of perfusion. Right. Then we move on to look at the types of shock. Number 1, we are looking at cardiogenic shock. That's type number 1, cardiogenic shock. I will explain cardiogenic shock. This is caused by inadequate perfusion of the heart. This happens when the left ventricle fails to pump enough blood and oxygen to the peripheral tissues, usually because of myocardial infarction. That is, the strength and force of the left ventricle is reduced because of extensive structural damage to the ventricle. Right. Cardiogenic shock only happens, it attacks the heart. That is the sudden reaction of the heart. So that sudden reaction of the heart results in that particular shock. Type of shock number 2, neurogenic shock. Damage to the spinal cord, particularly at upper cervical levels, may cause significant injury to that part of the nervous system that controls the size of the blood vessels, resulting in neurogenic shock. Right, this type of shock is as a result of vessel failure. We're saying that the skeleton of a human being, it is called the endoskeleton, and it is divided into 2 subdivisions. Right. The skeleton of a human being is called the endoskeleton. Endoskeleton is divided into 2 subdivisions. From the head to the waist, it is called the axial skeleton. Then this bottom part is called the appendicular skeleton. Our major concern is on the axial skeleton, where most of vital organs are found. Now, the neurogenic shock, we are saying it is a damage to the spinal cord. That's the sudden reaction of the spinal cord which causes this type of shock. Then the next type of shock, psychogenic shock. I also define the psychogenic shock. Psychogenic shock may also be referred to as fainting and is a sudden reaction to the nervous system that produces temporal reduction of blood supply to the brain. Because the blood momentarily pools in dilated vessels. Now, the psychogenic shock we're saying is also referred to as fainting. For example, as the athlete are in the field and then most of the athletes, they do faint in the field. Why? Because of the sudden reaction of the mind. Psychogenic shock. Each type of shock, it happens in each particular organ. Right. Metabolic shock, that's the next type of shock. Severe untreated illness may cause a state of metabolic because of profound fluid loss from vomiting, diarrhea, or excess urination. Now, in this type of shock, metabolic, the word meta meaning beyond the physical, beyond your imagination. For example, when you vomit too much, then you begin to think a lot. You begin to think beyond your imagination and can result to this type of shock, metabolic shock. It is commonly among the human beings. For today, we end here. Then we'll continue on part 2, looking at more types of shock and also how to treat shock. Have a good day.